And welcome back to Atlanta and Company. Thank you for watching. I'm Tom Sullivan. Back and neck pain are the most common types of pain reported by adults. So if you're sitting there right now watching Atlanta and Company, and you're staring at the TV and you're thinking, oh, my aching back, Dr. Matt Richardson of Peachtree Spine Physicians may have some comforting answers for you. How are you, Doctor? Welcome.
Great. Well, thanks for having us.
A pleasure to meet you. Now, listen, there's a new word in my vocabulary today. It's what you are. You're a physiatrist.
That's correct.
I said it right.
You did, and it's not uncommon to have a difficulty saying it correctly. In fact, even in our specialty, sometimes people will say physiatrist. Mm-hmm. We prefer physiatrist. Tomato, tomato, I prefer physiatrist.
Right. So you involve the spine as a physiatrist. So what do you do as a physiatrist?
Well, as a physiatrist, basically we treat anyone that has neck and back pain. When a patient comes in, we'll take a history, find out, where's your pain, where does it go. We do a thorough history and physical, do a physical exam, see if everything correlates. We also do diagnostic testing. That most commonly we'll get MRIs so that we can see the disc and so forth. We do nerve conduction studies or nerve tests to test the nerves and see if they're working well, X-rays and so forth. But basically, a patient comes in with back pain, we're able to formulate a diagnosis, tell them what's causing their pain, and then we go into the treatment phase. And there's many different ways we can treat patients with back pain. That may be as simple as anti-inflammatories. That may go into rehab, physical therapy, or referral out to chiropractor, etc. We even do procedures sometimes, interventional spine procedures. And if a patient is one of the few that needs surgery, we make the appropriate referral.
Okay, excellent. So when I think of a physiatrist and someone like yourself as a medical doctor, what does it take to become what you do?
Right. It takes a lot of school. After high school, we've got 4 years of college and 4 years of medical school. And then you go into residency, 4 years of residency. And then many of my partners, including myself, go to fellowship afterwards. So it's 12-plus years of training, and that includes, you've got to take all the boards, multiple boards and tests and so forth. So it takes a long time, and it's basically the same duration of training as, say, a neurologist.
Wow.
So it's
pretty in-depth, isn't it?
It is. It was a fun ride, though.
But that makes you feel good, though, when I'm coming to see someone like yourself at Peachtree Spine Physicians, that I know I'm getting someone really qualified.
Definitely.
Who's going to be working on my spine, taking care of it. So then, someone watching us right now who maybe has back pain and wants to get something done about it, well, who is your typical your client, coming to see you? Right. Who should come to Peachtree Spine Physicians?
Really anyone that has back or neck pain, or even simply just questions about back and neck pain, is actually the perfect, patient for us. Sometimes we see patients that come in and, they have some questions. I've been having some mild pain, I want to make sure everything's okay. Sometimes patients have more severe issues, and they have weakness and so forth, and they definitely need to be evaluated. I think probably the classic or the best patient is someone that has back pain that maybe sometimes radiates down the leg, something known as sciatica. There's other terms as well. Mm-hmm. Or, a similar process can happen in the neck, where you can have maybe like a disc problem or injury in your neck, causes problem going down the arms. But you could just simply have, focal pain in the neck or focal pain in the back. And, we look at the other joints to a degree, but for the most part, we're, neck and back specialists. So
when someone comes to Peachtree Spine Physicians for the first time, what makes you guys so unique?
Well, we have a different approach. I think first of all, we're MDs, which is kind of different in the spine world. Often you have the neurosurgeon or orthopedic spine surgeon who are great. We definitely need the spine surgeons, but it's nice to have an MD who can assess, all of your back pain complaints or issues. In terms of, being an MD, a lot of times we can prescribe the medications, we can do the proper diagnosis and treatment. So, I think the important distinction is we're MDs, and we work with all the other specialists as well to provide a comprehensive program for a patient.
What's really simple, if someone just wants to get a hold of you guys, they can take us kind of through the immediate process when they contact you guys. Schedule a consultation?
Right, exactly. We're peachtreespine.com is on the internet. You can call us on the phone, obviously, but we take nearly all insurances. Mm-hmm. So, anyone that just wants to be evaluated, find out, what's causing their pain, if they have questions, wants to know what their long-term prognosis is or what kind of rehab, just get on the internet, give us a call. It's very easy to set up an appointment. We really take pride in, trying to provide the best service, red carpet service for every patient. And, every patient that comes in, we try to get their response when they leave is, did you have a great experience? Sure. And if not, how can we improve? And so we really strive to, be a compassionate group of physicians that, really make the patient feel at home, feel comfortable, and obviously get the proper medical treatment.
Where is Peachtree Spine Physicians located?
Okay. Well, our main central location is in the Sandy Springs area. It's at the corner of Peachtree, Dunwoody, and Johnson Ferry. It's right there where Northside Hospital and St. Joseph's is located. It's often known as Pill Hill.
That's true. I have friends that work at both hospitals, so I'm familiar with the area.
But we also have other locations too, and it's nice. We try to be create convenience for our patients. We have an office in Johns Creek. We have an office in Decatur. We have an office in East Cobb. We have an office in Lilburn, and we may even expand in the future. I mean, just whatever it takes, to establish convenience for patients.
Well, it's been a great overview. Physiatrist.
Exactly.
I've got it down.
You've nailed it.
You're going to just take care of my pain. And I know, especially my brother's a golfer, and he suffers from back pain all the time. Right. Especially, I bet you see a lot of sports guys as well.
We do see a lot of sports. I mean, when you talk about sports, commonly, people will think of knee injuries and joint injuries. We see some of that. But in sports, there's a lot of back injuries. In fact, we have a lot of patients still come in and they have leg pain or joint pain, which is actually coming from the back. You talk about golf in particular. I know there's a golf segment earlier. It's amazing. Some of these the golf patients will come in and Doc, all I want to do is get back to what I was doing. I want to play golf. I don't care what it takes. Tell me what's wrong, treat me, get me back on the golf course. And I think getting it back to what a physiatrist is. I mean, we're MDs. And we focus on functional restoration. We're trying to get you back to doing those functions or activities you want to do. It may be gardening. It may be swimming. It may be exercises. It may be playing baseball in the front yard with your kids. Our goal is to get you there. And, a lot of times when people ask, going back to an earlier question, is, who should come see you? I want to kind of set up an example. If you had a chest pain, most of those patients would go to cardiologist versus a cardiothoracic surgeon. Okay, what we're trying to do is create that we're the cardiologist for the spine surgeon. Okay, you come and see us. We'll try to keep you out of surgery if we can. We'll show you all the options, the non-surgical options, and if you need surgery, if surgery's indicated, we'll make sure you get referred to the best surgeon in town.
It could be the worst case scenario in our head. We come to see you at Peachtree Spine Physicians. It could be something very simple. Right. So that's what we appreciate you coming today, man.
Sure. Thanks for inviting us, Tom.
And a lot of people right now, I'm sure, want to alleviate the back pain you're having. If you'd like more information about Peachtree Spine Physicians, here's the number. You can call them at 404-843-3323 or log on to their website right now and set up an appointment. It's peachtreespine.com.